Hello, and welcome back to the Medigap Show. I'm your host, Holly Cohen, licensed agent and founder of medigapcares.org, where you can book a 30-minute free consultation with me or a member of my team and learn about Medicare so that you understand everything there is to know. Before we dive into today's topic, take a moment to subscribe to the channel and like the video. Let's dive right into today's article. Here we go. Reported from the Daily News today, retired NYC workers sue to block Mayor Adams' latest Medicare Advantage plan. A group of retired city workers are suing Mayor Adams in a bid to block his administration's latest attempt to shift them into a privatized version of Medicare. The second time in as many years that municipal retirees have gone to court over the hot-button issue. The new lawsuit filed in Manhattan Supreme Court on Wednesday comes after retirees concerned about their health benefits being wrecked took legal action last year to prevent Adams from implementing the first version of his administration's cost-cutting Medicare Advantage plan. That version, which Adams pursued on the auspice that it would generate $600 million in annual health care savings, was blocked by judges who found a provision unlawful that would have levied $191 monthly penalty on any retiree who opted out of Advantage in order to stay on traditional Medicare. Look at that picture. Medicare, not profit care. I love it. Our lives are not for profit, fighting for our lives. Yes, they are. To get around that ruling, Adams' team this year devised a new plan that eliminates traditional Medicare as an option altogether and makes Advantage the only health insurance available to the city's roughly 250,000 municipal retirees to enroll retirees in it effective September 1st. But Wednesday's lawsuit brought by 9 retired municipal workers and the NYC Organization of Public Service Retirees, which has resisted the city's attempted Medicare shakeup for years, alleges the court should derail the new plan too, because it's an unjust bait and switch that violates various local laws. Well, that is just telling the truth here. An unjust bait and switch. They think they're on Medicare, and they're moved to the private plan of Medicare Advantage. Interesting. This is fundamentally worse. This is more deceptive and dirty even than the first plan. Marianne Pizzitola, a retired FDNY EMS who serves as president of the retiree organization, told the Daily News in an exclusive interview before filing the suit. Before, they said, you can keep your plans even if that means you have to pay for them, which we weren't going to do because that would be illegal. But this time, it's like, screw you, there is no choice. In addition to Adams, the suit names his Labor Relations Commissioner, Renee Campion, and other top city officials as defendants. The traditional insurance structure favored by Pizzitola's group features a city-subsidized Medigap supplement on top of the universal Medicare program. That means Part A and Part B, along with a Medigap. That's what the Pizzitola group wants. So under the administration's plan, retirees who'd want that would have to seek it out in the marketplace and pay for it on their own. Everyone else would get it automatically enrolled in Advantage. Unlike traditional Medicare, Advantage plans are administered by private health insurance companies and subsidized by the federal government at a higher rate. So let me go back to this paragraph. The traditional insurance structure favored by Pizzitola's group features a city-subsidized Medigap supplement on top of the universal Medicare program. Under the administration's plan, retirees who would want that would have to seek it out into the marketplace and pay for it on their own. Well, basically, that doesn't mean that they're getting it from their retiree plan. They have to just be like anyone else and go get it. So if they happen to live in the state of New York, they are allowed to get a Medigap plan without any health underwriting questions. However, if they live in any other state, most other states, they would have to go through medical underwriting to be able to qualify for a Medigap. Unlike traditional Medicare, Advantage plans are administered by private health insurance companies and subsidized by the federal government at a higher rate. Adams has said the savings the city could net from those subsidies are critical at a time when his administration is staring down multi-billion-dollar budget deficits in coming years. Well, that's not the fault of these people who worked for the city for all those years. The mayor and most of the city's public sector union leaders have also argued Advantage would continue to provide retirees with adequate coverage. Thousands of retired cops, firefighters, and other city workers organized by Pizzatola's group believe otherwise. Well, okay, so let me just say one thing. These are people that have worked for New York City, and they are New York municipal retirees. They were on traditional original Medicare, Part A and Part B, and now they're being forced off over to a privatized Medicare Advantage plan. They understand that there's a major difference. It means that the privatized Advantage plan would many times require prior authorizations for treatments. It would mean that the insurance company that this Advantage plan is going through is the determining body who makes decisions on someone's health care, rather than these nice people being on original Medicare, which is already in place since 1966, a federal law that if your doctor says it's medically necessary, original Medicare must pay it at 80%. It would take them off of that program and put them onto a privatized plan that is run by a for-profit insurance company. So see here, this picture, it's pretty interesting. The signs are holding up. Our lives are not for profit, fighting for our lives, Medicare, not profit care. So Advantage plans are there to take the majority of they were set up so that we wouldn't run out of money within our Social Security Medicare. And they were set up in the late 80s, early 90s as part of the Balanced Budget Act to essentially take half of our population off of our federal Medicare money and push the healthcare expense of our aging population in the United States over to a private insurance company to manage. And the federal government does pay per person per month to have someone come off of our federal Medicare fund and moved over to a privatized Advantage plan. So these people are saying, no way. They know the difference. There is a major difference between being on original or traditional, called original, or we call traditional Medicare, Part A and Part B with a Medigap plan versus being on a privatized Medicare Advantage plan. So I feel like this article and the story, unfortunately, it's hurting these people. It's hurting a lot of people throughout the United States, actually. But it's letting the cat out of the bag is what's happening. So anyway, that we'll wrap it up in just a moment. So as we come to the end of today's discussion on the New York City retirees and their lawsuit against Mayor Adams and the Medicare Advantage plan, I hope you've gained some valuable insights into the complexities of Medicare. Remember, staying informed about Medicare is crucial. That's why I encourage you to subscribe to the Medigap Show. By subscribing, you'll gain access to a world of information, expert interviews, advice, and helpful tips as you're on your Medicare journey. Don't miss out on future episodes. I'm going to continue to update everyone as news breaks and keep you current on all the Medicare information that's out there. See you next time, and be well.